Welcome to another edition of the DHHS Heart of Excellence Award recognition. I'm pleased to share the names and brief stories of the recipients for the Summer 2023 awards. Even though we're recognizing specific recipients today, I know this department represents some of the best public service in state government. The following recipients have demonstrated our department values of accountability, connection, efficacy, empathy, equity, impact, innovation, and support. And now let's go to the awards. The award for connection goes to Stacie James, a social service worker in the Division of Child and Family Services. Stacie has a passion for the work of DCFS. She often takes her phone home in the evening so clients who work late can get a hold of her on their schedule and not hers. She seeks out community resources and waits in long lines to obtain resources for children on her own time. Her caring shows in every interaction with her families. She listens and encourages difficult clients to change and has a high success rate in reunifying children with their parents and keeping children in kinship homes. She's making a difference in the lives of those we serve. Thank you, Stacie. Next is the award for impact. We are recognizing Amanda DeLucia, a health program specialist in the Office of Primary Care in Rural Health. Amanda joined the Office of Primary Care in Rural Health in February 2022 as an office specialist. In less than 12 months, Amanda has onboarded 12 staff across multiple offices within the clinical services section, streamlining the process to get staff to work rapidly. Neighboring offices now use her process. She's also wrote an operations manual that is now being used by the Office of Health Equity and Center for Medical Cannabis. Amanda has stepped up to edit PRCH's newsletter and supports additional outreach efforts. Amanda has edited monthly newsletters, manages a contact database, and distributes special bulletins to partners. Amanda is a partner across primary care and rural health. Due to her expertise, she helps break down silos. Her efforts result in savings in time, resources, and frustration. Congratulations, Amanda. The award for empathy goes to Becca Wright, a claims examiner in the Division of Integrated Healthcare. Becca has gone above and beyond to train new employees and is so understanding and patient. She's knowledgeable and kind and builds new employees' confidence to perform new tasks. Becca has shown a great deal of support and love for her team to accomplish great things. She's helped the RISE team that was sent over to learn how to work in PRISM. She is constantly making them laugh and makes a hard job enjoyable and easy to learn. Upon hearing that the RISE team was reducing team members, Becca went to her supervisor and fought to keep them employed with Medicaid. She went to bat for them and proved they are of value to the Medicaid team. They will soon be employed full-time and benefited with the department, thanks to her. Congratulations, Becca. Next is the award for innovation. Brooke Thompson is a graveyard shift ICR training instructor for the Division of Juvenile Justice and Youth Services. Brooke uses innovation to find new and creative ways to teach the lessons. When several mistakes were made in incident reports, she came up with a game and quick reference sheets to help staff remember them. She noticed one staff member who struggled with learning how to do clothing searches. This individual learned better when he was in the teacher role. She came up with a lesson where staff had to teach back how to do the clothing searches. Brooke understands that the more fun a training is, the more her coworkers will remember the information. This makes her building safer for both JJYS staff and youth. Thank you, Brooke. The award for equity goes to Allison Cowdell, a health program coordinator in the Office of Health Equity. The Office of Health Equity established an assessment to advance health equity called BOCA HE, which would not exist without Allie. She led the BOCA HE team through assessment development, process formalization, and fostered relationships with operational units, known as OUs, throughout the department in a thoughtful, bold, and welcoming manner. Allie created detailed agendas, tracking materials, and new templates to support future scaling of the project, all while being on top of implementation of the pilot phase. Through her organization, she has ensured OU's experiences and participation in the BOCA HE were collaborative, smooth, and unburdensome. OUs are properly introduced to the project, and she's always available to them. In addition, a plethora of health equity tools are currently being created under Allie's guidance and leadership. Congratulations, Allie. Next is the award for accountability. Susan Collier is an emergency planning risk management coordinator in the Division of Finance and Administration. In addition to being kind and empathetic, she has incredible knowledge about emergency planning and is always willing to share her knowledge with others. Multiple times, she's rearranged her schedule to help new COOP coordinators learn the planning process and have the resources they need. Thanks to Susan's work, we can sleep soundly knowing that if an emergency event occurs, we would be well equipped to manage it and continue providing health-based resources to the citizens of Utah. Congratulations, Susan. Our award for support goes to Sterling Webb, a custodian at the Utah State Hospital. Sterling is a hard worker, always has a positive attitude, and is extremely dependable. Sterling goes above and beyond on his daily tasks, is always willing to help his coworkers with their work, and quickly volunteers to clean up any spills or messes. Without him, the hospital wouldn't be as clean as it is. Additionally, he's known for his empathy and caring attitude. He genuinely asks his coworkers about their lives and offers empathy and a listening ear when it's needed. Sterling doesn't expect praise or recognition, but it doesn't go unnoticed. Thank you, Sterling. The award for efficacy goes to a new employee, Laura Ellsworth, a caseworker specialist in the Division of Services for People with Disabilities. Laura began working with a 16-year-old boy placed in JJYS Secure Care who qualified for disability services. The boy, abandoned by his family at 13, has multiple criminal offenses and failed several DCFS placements. In coordination with the JJYS caseworker, Laura met with the boy to better understand his disorders and attended his youth parole hearings. She searched for professional parent homes that could provide a sense of belonging for the boy, even conducting interviews of potential placements. Laura empowered the boy to make choices in a situation where youth feel like they have no control. By including other caseworkers, she demonstrated a different way of exploring placements. Laura's efficacy is evident by her advocacy for the best outcome for each person. Any individual working with Laura is lucky to have her in their corner. Thank you, Laura. Now, our first team award goes to the Southwest Transition to Adult Living team in the Division of Child and Family Services. This team supports a large group of young adults in growing their confidence, skills, and lifelong goals. In 2023, 7 TAL youth graduated high school and 3 are attending college. The Southwest region also has the highest attendance at monthly youth council meetings. The Southwest TAL team builds connections with the youth through empathy for their lived experience. They help the youth take accountability for their actions while also developing positive relationships and connecting them with resources to help them succeed. The TAL team works to ensure the youth have connections to everyone, not just their primary caseworker. They are innovative and always looking for improvements that can help them continue to positively impact the youth they serve. Now, our second team award goes to the Newborn Screening Program in the Utah Public Health Laboratory. This team works hard to ensure the accuracy and reliability of the results they report. Their meticulous attention to detail and unyielding commitment to quality directly impacts the lives of countless families and infants. They play a pivotal role in the early detection and treatment of critical conditions and are committed to equitable healthcare for all families. In the dynamic landscape of their field, the team consistently exhibits a proactive willingness to adopt novel technologies and methodologies, continually enhancing their processes and outcomes. Their contributions, while often behind the scenes, have a profound impact on the well-being of families and communities, bridging the gap between the lab and people they serve. Congratulations again to our recipients. We look forward to your nominations for the Fall 2023 Heart of Excellence, which will open on November 8th. Thank you.